It's not just the craziest year of bartending, it's the craziest year of my life and probably everybody's life at this point.
Jamil Chambers has been serving up drinks across the Commonwealth for the last 5 years.
It's a love, it's a passion. It gets me out to bed every day in the morning.
But the Richmond bartender now worries his passion could come to a halt as new restrictions aimed to reduce the spread of COVID-19 will take effect at 12:01 a.m. Monday morning. The new guidelines were introduced by Governor Ralph Northam on Friday and state that restaurants and bars must stop selling alcohol at 10 p.m. and close by midnight.
It's straining because a lot of these businesses, that's the majority of their business, that's the majority of their sales, is the alcohol revenue.
Not only do the guidelines change when businesses have to close, but they also will reduce all indoor and outdoor gatherings, both private and public, from 250 people to 25. However, that does not apply to bars, restaurants, schools, churches, gyms, or retail businesses.
This is all temporizing measures, non-pharmacologic interventions to decrease COVID-19 transmission before we have the arrival of a safe and effective and widespread vaccine.
Dr. Gonzalo Behrman is an infectious disease expert at VCU Health Center. He says these measures couldn't have come at a better time as Virginians head into the winter months where people will gather indoors for holidays.
Is this really worth the risk? Having multi-generational gatherings in a home. Cases are increasing. We could easily overwhelm health systems if we don't take these matters, the non-pharmacologic intervention, seriously and really push towards widespread adoption and use of the vaccine.
Meanwhile, Chambers just hopes everyone can take it seriously and another shutdown won't have to happen.
Businesses have been forced to close or shut down left and right, leaving the people that work in the tipping business out of work. And we're some of the hardest working, most dedicated people.
Now again, those new guidelines will take effect at 12:01 a.m. and violations will be enforced through the Virginia Department of Health as a Class 1 misdemeanor.